Then we'll see about viral hepatitis. So viral hepatitis, we have 5 major viral hepatitis. So hepatitis A, B, then C, D and E. So viral hepatitis A and E are going to be caused by a fecal-oral transmission. It's going to be caused by a fecal-oral transmission, and both of these hepatitis A and E do not have a carrier state or a chronicity state. So hepatitis A is going to be the most common viral hepatitis which is having a acute presentation in children, while hepatitis E will be the most common cause of acute viral hepatitis in adults. And then hepatitis E is quite dangerous in pregnant females. So during pregnancy, if they acquire hepatitis E infection, it can lead to mortality of the patient as well. Then we'll move on to hepatitis B infection. Hepatitis B is a DNA virus, and here it is going to be transmitted by sexual, parenteral or perinatal vertical transmission also. So during parenteral transmission, especially during needle stick injury, you'll have to remember this. So during needle stick injury, the risk of hepatitis B acquiring is going to be 6 to 30%. So the maximum risk. So in HIV, it was 0.3%, while in HCV, it is going to be nearly 3%, while in HBV, it is going to be 6 to 30% of risk of transmission in needle stick injury. Okay. So how do you detect this hepatitis? You'll have to do a serology profile. So the starting thing which we can detect will be the presence of hepatitis B S antigen. So HBsAg antigen is going to be the earliest marker you can check. And this is also going to be the epidemiological marker. So during studies, so to detect a particular population, they'll have to test for this HBsAg only. So that is why it is called as this epidemiological marker. And the persistent presence of this HBsAg antigen for more than 6 months, it denotes there is a chronic infection. Then nextly, we'll see the HBe antigen which is being developed. So HBe antigen is responsible for the replication of the virus. So more the amount of HBe antigen is present, it means that the virus is actively replicating. So the disease is going to be active. So active disease and replication and infectivity can be detected by measuring the HBe antigen. Then we'll see for the IgM anti-HBC. So there is going to be a core antigen and which is HBC antigen. So the antigen you will not be able to detect it on serology. So HBC antigen detection is not there. So directly we get the anti-HBC antigen IgM antibodies. Okay. So IgM antibodies directed against this HBC antigen will be the first antibody to be detected. And here it is going to be important because this antigen antibody is going to be detected in the window period as well. Okay. When rest of the everything is going to be negative, this IgM anti-HBC will be still positive. After anti-HBC IgM antibodies, the development of anti-HBe IgM antibodies. So against the replicative antigen, we are going to have antibodies. Then finally only we'll have the anti-HBs antibodies. Okay. Again IgM. So IgM is the first antibody to come, right? So it will be always be IgM. And then you will get the first antibody. If they ask, don't confuse it with HBs antibody. It is going to be anti-HBC. Okay, anti-HBC, anti-HBe, then anti-HBs. So this is the order of the antibodies. So apart from that, you can also measure the HBV DNA. So that will give the approximate viral load of the patient. So it is going to be a quantitative marker giving the viral replication and the viral load. Okay. So this will determine the whether the patient is having an active disease or whether the patient is having a just a carrier state. Okay. So for that also, this HBV DNA measurement is important. It also helps in giving treatment options. So some of the MCQs related to hepatitis B viruses will be, this is going to be, HBV is going to be the most common viral hepatitis causing hepatocellular carcinoma firstly, then also carrier state, and then it is associated with blood transfusion at the maximum. So 30% risk I told, needle stick injury. So HBV can be transmitted through blood transfusion as well. So that highest risk is associated with hepatitis B here. So this is very important. So HBV, HCC, carrier state and blood transfusion. So it is the maximum for HBV. So on microscopy, you can see the specific feature called as ground glass appearance of hepatocytes. So in this image, if you see, These are the normal hepatocytes which appear granular, right? But to the right part of the image, you see all of these hepatocytes which have a glassy kind of appearance, a smooth, glassy kind of an appearance. So this kind of appearance is called as ground glass appearance. It is because these hepatocytes are distended with the virions, the HBV virions. So that is why it is having this ground glass appearance. So this image can also be given for exams. So the next hepatitis virus will be hepatitis D. So hepatitis D is an incomplete virus. It needs HBV, hepatitis B, to complete its cycle. So here you can have two types of infection, super infection or a co-infection. Super infection is going to be much more common, 90% of the cases. So in super infection, what happens actually is this HDV, this hepatitis D, is going to be present over a HBV infection. So already HBV infection is there. On that super added HDV infection is going to come. So that will result in chronicity. While a co-infection is quite bad, that is both HBV and HDV is going to occur together. So double dose is there and that is going to result in fulminant hepatitis. So rare but still very dangerous. Then hepatitis C virus. So hepatitis C virus again is transmitted through parenteral, sexual and vertical transmission. And here it is going to be the most common cause of viral hepatitis, leading to chronicity and then cirrhosis. So C for C, hepatitis C also has a C. So HCV is for chronicity and cirrhosis. Don't confuse the carrier state here. HBV was for carrier state, for hepatocellular carcinoma causing, and then also for blood transfusion, associated with blood transfusion. So these are direct MCQs which can be asked, so don't confuse between these two. Carrier state, you don't have with HCV, it is HBV which is more commonly associated with carrier state, while chronicity is much more associated with hepatitis C. And in hepatitis C, you have a constellation of microscopic features. So starting with macrovascular steatosis. So even though not specific, you will have macrovascular steatosis. So these kind of full vacuoles of triglycerides are going to be present. Apart from that, it is going to affect the periportal region. Remember, alcohol was around the centrilobular zone, that is zone 3, while viral hepatitis is going to be more towards the periportal zone, so zone 1. Okay, so periportal inflammation. So being a viral infection, you'll have lymphocyte, right? So there will be lymphoid follicles and lots of lymphocytic infiltration at the periportal areas. Then other than that, you also have Councilman bodies or apoptotic bodies. So hepatocytes are undergoing apoptosis. So this cell, which is appearing dark eosinophilic, right? So with the smaller cytoplasm. So compared to the size of this hepatocyte is quite small and dark, right? So this is an apoptotic cell, and the apoptotic cell in a viral hepatitis is called as a Councilman body or an apoptotic body. This exact image also has been asked as a image based question, and they'll ask you the reason for this, okay? Reason or the name of this, whatever. So in chronic HCV infection, you see this macrovascular steatosis along with periportal lymphocytic aggregates and Councilman or apoptotic bodies.